You know, as I was preparing this talk, I realized that I've been doing autism research for more than 20 years. And if that doesn't make you feel old, the other day, I hurt my back by pulling up my sock. And I was practically immobilized for the entire week. So at the start of my career, part of my job was to interview parents about the onset of autism in their child. They all had their own stories, but they all converged on a common theme. Too much time had passed between a parent's first concerns and diagnosis. Like I said, that was 20 years ago, and I still hear the same stories today. It's almost as if nothing has changed. But a lot has changed. We have evidence that autism begins long before the delays in the behaviors ever emerge, and we're much better at detecting autism in very young children. We also know that early intensive behavioral intervention produces the best outcomes for a child with autism. Yet our community and others like it all over the country have an average age of diagnosis that's close to 5 years. That's unacceptable given what we know. Why are there these delays in diagnosis? Well, it's not just one problem that can be identified and solved. It's a series of problems that disrupt the whole process from parents' concerns to diagnosis. The whole system needs improvement. So based on years of experience with working with families at SARRC, we've identified 3 main barriers to the diagnostic process. One, there's a lack of consistent guidelines for early screening. Yes, the American Academy of Pediatrics recommends that we start screening at 18 months and 24 months to detect kids with autism, but quite honestly, with all the delays in the system, that may not be early enough. 2, families have limited access to diagnostic professionals. What happens after a referral is made? Families call around to different professionals to get that evaluation that they need, and they face long wait lists, 8 months, 10 months, 12 months, maybe even longer. 3, autism is sometimes just harder to detect, particularly in older children. We need to do a better job at detecting these gray area kids that have just enough skills to get by early detection methods, but then show problems later on once they get to elementary school or junior high school or even beyond. So we know that these barriers exist. And now SARRC has 3 major initiatives that we're working on to help smooth this pathway out. First, we want to make screening the standard of care at the 12-month well baby visit. SARRC is partnering with the University of California, San Diego, to bring their evidence-based screening program to Phoenix. And we're funded by the National Institute of Mental Health to develop a network of pediatricians who will all follow the same very simple screening procedures in their office. It adds less than 5 minutes of patient time. Whenever a child is identified in need of an evaluation, they can be referred to SARRC, and we can see them free of charge. There's no fees, there's no long wait list, just answers and guidelines about their next steps. So together with UCSD, 15,000 children will be screened in the next 5 years in this project. This project will lower the age of diagnosis in our community, and it will provide important information about the incidence of autism and other methods for early detection. Second, we will improve access to diagnosis. Families outside of our pediatrician network can access diagnostic professionals through a project we call NODA. This is designed to accelerate the diagnostic process. And parents who have concerns about their child can download the NODA app, which will guide them to collect clinically relevant information in their home, which all gets uploaded to a secure web-based platform. Then clinicians at SARRC can log in, review all of the information needed to determine whether or not that child has autism. In return, the parents get a detailed report which they can use to access intervention if necessary. We've been working on this project for a long time, and after years of development and testing, this service is now commercially available. NODA simplifies the diagnostic process and makes it accessible to more families faster, at a fraction of the cost and a fraction of the time necessary for an in-person diagnostic assessment. Last, we will develop a system to regularly screen school-age children for autism. Through our research a couple of years back, we developed the DAVE screening questionnaire, which helps to identify school-age children who are at risk and need an evaluation. Then we demonstrated its accuracy in a large sample of general education students. We want schools to use the DAVE screening questionnaire to screen school-age children whenever they go for their regular hearing and vision checks, so it becomes a regular part of the process. A teacher can complete the DAVE screening questionnaire on every student in her class in less than 10 minutes, and anybody that scores high can be referred out for an evaluation, and that family can get answers about their next steps going forward. So the importance of early detection is not unique to autism. It's a consistent theme across many treatable conditions because early detection saves lives. Just imagine you have a scare with cancer or diabetes. You wouldn't want to wait 18 months before you did something about it. Autism is no different. Autism is treatable, and early detection can make the situation significantly better for everybody in the family. Parents will have answers sooner, children will be in treatment earlier, and we will improve their chances for a higher quality, independent life. By changing the system now and smoothing out this process, we are paving an easier path for all going forward. Thank you very much.